Hello, my name is Jennifer Bannon, and I'm the Director of Admissions here at the Functional Medicine Coaching Academy. I'm very happy to be with you today. Also joining me is FMCA's International Relations Coordinator, Mahnaz Malik. Thank you for taking the time to be with us, whether you're watching live or the recording. We want to spend this time together telling you a bit about us and also support you by letting you know about peers in your region, as well as exciting local organizations. We at FMCA are strong proponents of the idea that coaches will be the future of healthcare, which is why the Functional Medicine Coaching Academy was founded with the Institute of Functional Medicine over 5 years ago. In a world that's seeing a large increase in chronic illness, there's a new model catching on, and that's a doctor working with a health coach. Doctors are bringing in coaches, but others in the healthcare arena are also bringing in coaches. We're seeing growth in corporate wellness and the private sector as well. Health coaches are needed. Why? Because the model works. FMCA coaches are trained to work closely with clients around all of the modifiable lifestyle factors that influence health, such as sleep, relaxation, exercise, movement, nutrition, stress, and relationships. Our graduates gain a solid understanding of the foundations of functional medicine and its root cause analysis approach. They are fully trained to utilize many of the IFM resources, such as the timeline, matrix, and food plans. This background allows them to understand, and with the addition of their coaching skills, support the client to implement functional medicine treatment plans into their lifestyle. A health coach moves beyond the diagnosis prescription model to co-create and execute a plan with the client that inspires them to a path of better health. Additionally, under the delegation of a treating physician, the functional medicine health coach may be able to provide further assistance to related labs and supplements. A functional medicine health coach does not assess, prescribe, diagnose, treat, or interpret results. Our graduate skills are applicable to all types of practitioners, from nutritionists to naturopaths and integrative doctors. We are the magic ingredient in the area of behavior change. Our course is 12 months based on a series of learning modules. Content is uploaded onto an educational platform called Canvas. We go through the program with a small group or cohort of fellow students guided by a course facilitator. 3 times a month at a time you self-select, you'll meet together on Zoom video conferencing to go over the material being covered and practice the coaching concepts being taught. We encourage you to spend time on our website for more information. Download our info packet for details about continuing education and other particulars, and then to schedule a call with a member of our admissions team. Enrollment for our September 2021 class is soon to open. We'll touch more on that later in this time together. We welcome students from a variety of backgrounds, not just from healthcare. Without further delay, I want to introduce you to Mahnaz, who's from the UK and currently lives in Saudi Arabia. She was in the July 2016 class of FMCA. Mahnaz wears many hats. She's a course facilitator, admissions team member, and our international relations coordinator. In her role as international relations coordinator, she supports our international community. I'll turn things over to Mahnaz now.
Thank you, Jen, and thank you all of you for being here today. It's so exciting to be able to chat with you all. We have Isabella Natrin from the UK Health Coaches Association, and we have 3 of our lovely alumni. So as FMCA's International Relations Coordinator, I have the privilege of serving and supporting these forward-thinking, pioneering, and mission-driven international community of students that join FMCA. We have students from over 60 countries around the world right now, and these exceptional individuals are creating and driving positive change in health and wellness in their communities around the world. So I'm going to start with Daniela first. Daniela is a functional medicine certified health coach. She's a naturopathic nutrition advisor. She's a certified gluten-free practitioner and an autism support certified coach. So Daniela is also the founder of Positive Health Space. That's an online coaching practice aimed at empowering and supporting parents of children with neurodevelopmental issues such as ADHD, autism, and learning difficulties. In her work with parents, she helps children get relief from tummy aches, headaches, irritability, and anxiety while improving behavior, communication, and sleep. All of this, making family life less stressful and more manageable. Parents working with her comment that they go from feeling like their children are missing out on childhood itself to being hopeful for a future of happiness and, most importantly, potential. So thanks for being with us today, Daniela. The first question I want to start with is that you have, obviously, there are a number of certifications that we can see there. And we have other graduates, other students as well that always join with plenty of other certifications. And you were already practicing. So what made you decide to add the FMCA training to what you already had?
Hi, Mahnaz. Hi, everybody. Thank you so much for that lovely introduction. So my coming into the functional medicine world, like for most of us, comes from a place of personal struggle. My youngest child became very ill at the age of 18 months. She stopped breathing, and in the year that followed, which was a bit of a blur now, she was diagnosed with autoimmunity. However, her symptoms and her diagnosis didn't really go together. There was still something amiss, and we saw specialists in 3 continents, 5 countries, and the answer was always the same. Medication, mostly steroids, and there was nothing else that we could do. And I'm not going to go into the details. I could accept the fact that she was ill. I could accept the fact that she might need medication. But what I couldn't accept was the fact that there was nothing that I could do for her to improve her quality of life. And that made me feel really frustrated and kind of hopeless at times. And that's when I started taking things into my own hands and making lifestyle changes. And what I noticed was that with the changes that I was making, even though I knew nothing at the time, the difference in her quality of life was actually not just little, it was significant. And so that's how I then found naturopathic nutrition and functional medicine. And as I was studying naturopathic nutrition, and it came to the point where I had to start seeing clients as part of my certification, I realized that most people actually knew what to do. They had a pretty good idea of what they were supposed to do, but they didn't know how to do it. They still weren't doing the things that they knew how to do. And so when the advert for FMCA came across my laptop, it was like, yes, this is it. This was marrying, helping me get people to actually do the thing, and functional medicine, which I'd become completely and utterly obsessed with at this point. And so really it was a no-brainer for me to go through the FMCA certification.
Well, thanks for sharing that, Daniela. It seems that through that whole experience, you've now developed a very specific niche. So you're supporting and empowering parents of children with these neurodevelopmental issues now. How do you use the training in your practice at Positive Health Space?
Well, I think, first of all, it has to be said that what I learned at FMCA is, and what you will learn at FMCA if you join, is not just a tool for business. It's literally changed my life. It's changed how I show up in my life every day. It's the principles that really make up the skeleton of every single one of my packages. And from personal experience, I know that a health journey can be lonely, it can be frustrating, it can be overwhelming and full of doubt. And so being able to establish a relationship and a rapport with a client, and being able to identify their readiness for change is really a game changer in helping them actually achieve what they want. And these are the skills that FMCA taught me. And, if you think about it, the ability to make lifestyle changes and the need to make lifestyle changes is at the basis, at the heart of all of the IFM practitioner prescriptions. But with the best prescription in the world, with the most experienced IFM doctor in the world, if the client in front of you is not able to put that into action, then the prescription itself has a lot less worth, if you want. So what, you know, FMCA teaches you those steps to get the people moving in the right direction. And what I offer in my introductory package today, I could have offered on day one of coming out of FMCA. It really is the basis of everything that I do with parents and with children.
It's so good to hear that, Daniela, and to hear how useful, you know, you've been finding that training right from the beginning. So you're actually a very active member within the FMCA alumni community. So what are you involved in?
I'm a connector. I love to help. So I love being involved. You know, I realize that I am one person and I can only coach so many people, but if I can help other people get coaching, then together we are coaching so many more people. But really, one thing that really resonated with me when I was going through the FMCA program, and it was like the one thing that I really wanted to be part of when I came out, was this idea of a patient care team, of a client care team. You know, this idea that it takes a village. Well, it takes a whole team of people to get somebody better to the right place where they need to be. And so I was so excited. But when I graduated FMCA, I wasn't living in the UK. I was the first FMCA graduate in the country that I was living in, and nobody even knew what functional medicine was about. So I went from all this excitement to feeling very lonely. But perseverance is one of my strengths. And so I thought, just because it doesn't exist, you know, it doesn't mean it can't exist. And I started getting people together, and I used James Maskell's functional forum model to get different practitioners together, different modalities together, and started talking more about functional medicine and using his videos to teach people about functional medicine, and sort of as you know, it grew over time. And then I moved to the UK. I'm kind of still involved in that. And then I moved to the UK, and because these meetups are in person, COVID had kind of made it die a natural death. But together with a couple of other FMCA graduates, we picked it up, revived it, and brought it online. And so for the last 2-3 months, we've been running the online functional forum here in the UK. It's been really amazing. The feedback has been amazing. The engagement has been amazing. The speakers have been amazing. The support that we're getting from the community. People are making connections with, you know, coaches and doctors, different integrative approaches, meeting and realizing, you know, what is possible. People telling their story so that, you know, everybody realizes what's going on. And I have to say thank you to you, Mahnaz, and FMCA for running the international office hours, because otherwise I wouldn't have been able to make contact with the, you know, the alumni that I am actually collaborating with, and finding this amazing community here in the UK.
Well, Daniela, it's people like you that make the community. You know, that's how it comes about. But you know, we're really fortunate to have an amazing community, and it's great to hear all that you're doing with them. Thanks for sharing all of that. I'll move on to Katie.
Welcome.
So Katie has been through her own personal health journey, which led her to a desperate need to find out the why behind being chronically ill for most of her life. It was only when she saw a functional medicine doctor who asked her about her childhood, career, and relationships that she realized there was so much more to work on than just managing her symptoms. Her functional medicine doctor, Jess Braid, encouraged her to pursue her passion of helping people make a difference in their lives by joining Functional Medicine Coaching Academy. So I'm really glad to hear that you had a functional medicine doctor recommending us, obviously. Katie is now a functional medicine certified health coach using @Mum and Health Coach to help people grow healthier, happier, and more empowered. So thanks for being here, Katie. And I just want to start with the first question being similar to half of the population, our student population at FMCA. You come from a completely non-healthcare related field. I mean, you were an advertising sales manager with a national newspaper, and you're now fulfilling your dream of a career in functional coaching. So what would you say to someone who's in a similar situation, wondering whether or not they can join the program?
Well, thanks for that. Thanks for inviting me on. And what I would say is you definitely don't need a healthcare background to enroll in the program. I was aware of functional medicine for several years beforehand, because I was going through the program myself. But what I learned was still so just exciting and eye-opening and informative. And I think if you don't even have that background, it's even better. Like, it's just life-changing. What you will learn in the program is pretty incredible. So I'd say, you know, that's definitely not a requirement. You know, just have that desire to find out more, you know, to find out if there are alternatives to conventional medicine, have that curiosity, have that love of learning. And I always had the desire to help people and to make a difference. And I didn't know what that looked like for several years. And then, as I said, Dr. Braid recommended it, and I was like, yes, this is it. This is what I've been waiting for. So, and yeah, it has been really life-changing.
Oh, thanks for sharing that, Katie. So I just want to move on to something that you mentioned to me personally. You said in 2020, it was quite a challenging year. I mean, it was a challenging year for most people, like for all of us. But and you are, you know, certainly no exception to that. But you came through that better than you'd ever imagined. So can you tell us more about that?
Yeah, I mean, like you said, obviously the COVID pandemic was tough for everyone in different ways. I was, when it all sort of first lockdown happened, I was halfway through the course, so I was working full time and studying, and then, you know, next thing I had my young daughter at home, and my husband was at home, and it was sort of reimagining, you know, your life really. And then I graduated in September, started immediately coaching, and then by the time the second lockdown hit in the UK, my husband was back to work, my daughter was still at home, and then I suddenly had 2 jobs to manage. So, you know, but I think part of the course actually was really helped me, because it was focusing on positive psychology, and that's what I had to harness really. It was actually, I'm doing what I've wanted to do. You know, COVID has given me the opportunity to work from home, so I can work more flexibly. It gave me these opportunities to start coaching as well in my spare time. So I was just trying to reframe it and think, this is a positive. I'm starting on this journey. And subsequently I was made redundant from my main job, but I already had the foundation of the course and the coaching. So again, I thought, this is all good, you know, this is what I want to do. And now it's about looking forward and making a career, and also raising awareness of health coaching in the UK.
I mean, that's really inspiring to hear, Katie, because it was almost as if like perfect timing, you know, to be London and to already have been in the program at the time. I mean, things couldn't have fallen together at a better time. So on top of all of the people's lives that you're changing with at Mum and Health, you're also involved in another exciting project that's just launched. And it's really amazing to see how functional medicine doctors with a functional medicine certified health coach working as a team, what they can actually create. So could you tell us a little bit more about that?
Yeah, absolutely. So it's a company called ADIO, ADIO, adio.org, which is just launched. And it's a collaboration between 2 sisters, Dr. Braid, who's the functional medicine practitioner, and her sister, who's a doctor of chiropractic. And they have launched what will hopefully be a global health community. And it's really bringing functional medicine to the masses. So it's going to be a community where people will join and, you know, make connections and form groups, access a wealth of information, join live webinars. There are courses and toolkits you can complete. So it's about, you know, Dr. Braid always said to me, you know, there's only so many hours in the day, there's only so many people she can treat. And actually, we just want to get the word out to everybody that there is so much you can do for your own health, whether that's nutrition, exercise, sleep, stress management, relationships. It's so important, and it's about empowering the individual and getting them to take back control of their own health. So I'm involved with setting up the launch and the company going forward, and it's about really raising awareness. And yeah, I sort of encourage everyone to head over to adio.org, just have a look and sign up, as you can sign up as a founder member. And hopefully it'll make a really big difference in the functional medicine community.
Well, that's really inspiring to hear, and especially in the UK, and to know that it's all growing. So thanks for sharing that, Katie. Okay, so I'm going to move on to Stuart. So Stuart Carter is the CEO of Three Trees Community Support Limited. It's a care provider for adults with learning disabilities based in Bristol in the United Kingdom. And he's the founder of The Healthcare Coach. Stuart's passion is to enhance quality of life, whether it be for him and his family, the services that his company provides, the staff who deliver those services, or for anybody else who'd be willing to undertake such a journey of self-discovery. His 2016 diagnosis of ankylosing spondylitis, an autoimmune condition, was the catalyst for his newfound passion. Stuart now applies his functional medicine coach training to support employees at Three Trees and offers coaching to anyone willing to enhance their health and well-being. Stuart primarily offers coaching to those within the health and social care sector, as he recognizes that those who care for others often forget to take time to take care of themselves. So thanks for being here, Stuart. I know that you're the CEO of a company providing this care for adults with learning disabilities. What made you realize that FMCA is the program for you? And was there anything that surprised you about the program when you joined?
Hi, Mahnaz. So it was really, well, kind of looking in online at various other programs. And then coming across the FMCA, it was the affiliation with the IFM that really stood out to me. I felt for me that was an important aspect of standards. And the other thing was really having spoken to you, Mahnaz, your welcoming disposition and your introductory kind of comments just made me feel so at home. And for me, it just felt like the right place to be. So you helped me to understand what could be expected and all the benefits that, you know, the FMCA could actually provide. I also really like the fact that, you know, functional medicine takes a holistic and integrative approach. For me, that somebody, you know, supports adults with learning disabilities and quite often for 24/7, that made perfect sense. So those are some of the kind of things that really stood out to me. Admittedly, I was a little concerned with whether all the promises could be actually fulfilled, but they were. I really shouldn't have worried about that. You delivered on every single one of them. Just trying to think. So for one, for example, was, you know, one of the benefits was to kind of provide us a good environment and a bunch of new friends amongst your cohort, and you'll meet like-minded, similar people. And I just wondered how true that was. But not only have I met a bunch of new friends, you know, I'm in various different cohorts now. I think Daniela kind of alluded to this earlier. The hard thing for me now is actually kind of saying no to certain groups because you're just going to end up running out of time. So it's been a really positive experience for me, and you know, I've built a lot of connections and made a lot of new friends, and you know, it's been truly a wonderful experience. So and in terms of surprises, the positive psychology aspect was a huge thing for me. I didn't really know much coming into the FMCA about positive psychology, and now I'm really super interested in positive psychology. And I think the other thing would be how I came into the FMCA thinking that I was going to go away and do one-to-one sessions with clients, which I'm doing now, and I'm very happy with that. But I never really considered the group coaching sessions, and that was a big surprise for me, because coming out and having graduated with the FMCA, I feel that I do have the confidence to go out and facilitate or run group coaching sessions. And not only that, but I'm actually really excited about that kind of prospect. So yeah, I think those are the things that kind of surprised me.
Oh, thanks for sharing that, Stuart. And I do want to get in there that I think our admissions team is super special. And if you speak to any one of them, you'll feel this sense of hospitality. So we really do encourage everybody to book a call if you'd like to know more. The next question I wanted to ask you was that how are you actually applying everything that you studied at FMCA with your staff and work within the health and social care sector?
So as I said, positive psychology was a big surprise for me. And so much so that as soon as I started finding a little bit about positive psychology, I grabbed my HR manager and was like, we have to learn more about this. So we went on additional courses and delved deeper into that. And with the intentions of actually imparting that onto my staff. I have about 80 to 90 staff. And really feel that there's a lot of correlation between care workers, positive psychology, and how we can use that to be resilient and to also impart that onto those we support. So that was a kind of a major takeaway, and something that I really think the whole entire health and social care sector could benefit from. I'm also now coaching my staff and people that have actually left the company as well. I actually got off a call earlier. I was on a coaching session earlier with a member of staff who had left, and currently supporting him through his own personal trials and tribulations. And yeah, just got off the call with him, and he kind of mentioned that he's feeling a lot more positive after our session. So it's nice to know that, you know, you're helping people and you're adding a little positivity into people's lives, and all the training and the guidance that we've taken from the FMCA, that come straight out the doors and they're immediately applicable. So yeah, and I think the other thing that I do plan to do in the future is run group coaching sessions. It'd be really good to not only support my staff in terms of their lifestyle factors, but to introduce them to the idea that this can also have a positive impact on those they serve, those that they support, and to bring the correlation between their own health and well-being and the health and well-being of those that they support, to bring those to the forefront of their attention and to understand that correlation.
Well, thanks for sharing those details, especially about positive psychology, because we have the big, quite a lot of big names and in our program when it comes to positive psychology. I must say, actually, I have to point out that it's only been 10 days since you graduated from one of our special classes, because you were in the June 2020 class. And within 10 days, you've just graduated, but you've literally hit the ground running with, being a founder at the Healthcare Coach. How did the program get you to this point?
Well, I think it's funny because you think as the training kind of draws to an end, things would start to slow down a little bit, but that's not the case at all. If anything, it ramps up. Like I say, you end up joining new cohorts, meeting new people, connecting with others, and as a result, your opportunities they increase. So yeah, I find that to be quite funny, and also I was before even receiving my graduation certificate, I was invited to come on this call. So that's one opportunity straight out the bat that I was more than happy to be a part of. So yeah, that was helpful. The FMCA really do kind of give you the tools, the resources, and the opportunity and the connections to not only kind of finish the course, but it sets you up to just jump out into the world armed with all this confidence and the tools and the resources to facilitate change in and amongst other people.
Well, we look forward to seeing what you're going to do and carry on doing, as well as all our other graduates, our alumni at FMCA. So thank you all for sharing that. And now, I'm, obviously really pleased again to see you, Isabella. It's really, really great to have you here. So Isabella is the CEO of the United Kingdom Health Coach Association, where, health coaches in the UK are really fortunate to have the association as their advocate. Isabella is a qualified nutrition and lifestyle medicine health practitioner, and she's a credentialed health coach herself with over 30 years of experience in health, wellness, and executive management space. She's leading the organization in its next exciting phase. So I know we've had you on before, Isabella, but just for those who are joining us for the first time, please tell us a little bit about the association and its vision. You'll need to unmute.
Here I am. I'm always on mute. I always forget. So thank you very much, guys, for welcoming me again to the FMCA webinar. And I'm really excited to be here and to share all the news that we have at the UKIHCA. So that's the UK Health Coaches Association. So we're the professional body for health coaching in the UK and Ireland. And we're concerned with the advancement of health and wellness coaching with a whole health creation and sustainable behaviour change model at the heart of preventing, managing and potentially reversing lifestyle related conditions. But also to support those who want to stay well, want to age well and want to just be well. Our vision at the association is for every individual to be empowered to manage their own health and wellness and to thrive in life. And who wouldn't want to do that is my question. And that's why we need health coaches, well-trained, well-qualified health coaches. And we want to see a health coach in every healthcare practice in the private and the public sector, in schools and colleges, in businesses and in communities where, I agree that the group health coaching model is one that is really important for developing community health initiatives. And it's something that we're building into our new professional standards, which I'll talk to you about in a moment. So we were established in 2018 as the first professional association for health and wellness coaches in the world. And we now have over 600 members, some of whom are student members. We're a non-profit organisation. And we're staffed almost entirely by volunteers. So it's blood, sweat, tears and grit that have got us to where we are today. We're still the only professional body for health and wellness coaching in the Northern Hemisphere. The national board in the States are not a professional association. They're a credentialing body and to accredit training programs and issue board certification. They're not a professional association. And the only other at the moment professional association is HCANSA, the Health Coaches Australia and New Zealand, which was established in 2020. And that is driving development down under, as they say. So we at the UKIHCA are very honoured to be regarded as one of the global leaders for the advancement of this rapidly expanding and exciting field. And we are a member of the Global Wellness Institute's coaching initiative, which at the moment comprises the States, the UK, Ireland, Australia and New Zealand and Singapore, with a European representative coming on board soon. So that gives us a really valuable global perspective on everything that's happening in the health and the wellness space. So that's a little bit about the association.
Oh, thanks, Isabella. That's really good information for everybody to have on hand. So regarding the, let's say, updates, we know that it's been quite a year with the pandemic and the lockdowns, and yet UKIHCA has been working harder than ever. So would you be able to share some updates around the work that you've been doing?
Oh, definitely, yes. we have been very busy, and we've been having to pace ourselves and, you know, walk the talk, so to speak, and actually sometimes put our health first before we do another day's work or another hour sitting in front of a Zoom meeting. But you know, we're very lucky to have built up through predecessors and through the current team, you know, a really good, strong reputation globally. So we are finding that increasingly we're being asked to be involved and participate and collaborate in the work of a variety of other agencies allied to health and wellness coaching. And these could be in the private lifestyle functional medicine sectors, at the NHS and the new Personalised Care Institute in the UK, and of course the professional and corporate wellness, health and wellness space. So we're very busy networking and supporting and, you know, arranging to go on panels and giving our expertise away, because we're very, very dedicated to really expanding people's understanding and awareness of what the potential of health coaching and health coaches can bring to individual and public health. So that's a big job for us. We have launched now the new standards for education and training for professional health and wellness coaching. So yay, and thank goodness. It's been a hard year of working with cross-industry representatives and major stakeholders from every conceivable angle to, you know, give their input into the standards. And our Director of Standards, Faye Hall, has just launched the new standards. So you guys will be receiving a copy of it very soon. And I'm very excited to say that, you know, our model is based on whole health. So that is the, you know, my background is in nutrition and lifestyle medicine, but I also have a big interest in functional medicine. And have been involved in also organising functional medicine groups within the Birmingham, within the Midlands region. So we've based our standards on the framework that the National Board have set up. So thank you very much, National Board. But we've extended the health and wellness standards to meet the needs of the UK and Ireland market. So the health and wellness standards are a little bit different from those that the National Board have established. We are also founder members of the NHS Personalised Care Institute's expert advisory group for the register for health and wellness coaches working in the NHS. So this is a new thing that's coming. And I'm very pleased to say that I anticipate that every member of the UK Health Coaches Association will qualify to go on the register, because our standards are robust, and it will qualify people to be able to work in the NHS and be registered as a HWC within the NHS. We're also opening our doors to affiliate membership, because much like several have said today, we need to network, we need to drag people, other healthcare practitioners and allied healthcare practitioners out of their silos and into a multidisciplinary space. So we're opening our doors to affiliate membership to encourage networking and an understanding of each other's disciplines. And really, at the end of the day, it's about creating job opportunities and career progression for our coaches, and for demonstrating the value of what they can do to support other professionals. And we're actively building partnerships and collaborations with other bodies and organisations in the lifestyle and functional medicine space. So working with other associations, with schools, with anybody that we can persuade needs us there at the table with them to fly the flag for health and wellness coaching.
Oh, well, thank you for all that you're doing at UK Health Coaches Association. This is really good news, especially, you know, for all coaches, but especially for functional medicine, FMCA coaches. Is there anything else that you'd like? Because I think you've covered most. I was going to ask you if there are what you have to offer for coaches, but that seems to have covered quite a lot. Is there anything else for someone who wishes to join you that you want to add to that?
Well, I think I'd really like to encourage students to join as soon as possible. Why? Well, because they're only going to be paying £10 a month or £120 a year, so it's not going to break the bank. But there are huge benefits for a new student to join. You know, so as they register for a course, they're entitled to apply for membership, and that means that they can join a community straight away. So whilst they're building their communities with their course, such as FMCA, they're also getting an understanding and being exposed to health coaches that are actually in practice. So we offer a whole range of benefits, really, in terms of a Facebook community where there's peer support and networking, not only with other students, but with full members. So you can ask questions, you get a feel for what people are doing. You don't feel, when you come out of your FMCA course or any other course, you don't feel, all right, so what next? You know, where do I go now? You know, there is that opportunity to build not only and to cement really friendships that you've built on your course and carry those through the whole of your career, really, and not lose touch with people. But excitingly, we're increasing our program of mastermind seminars, webinars. So we had Sandy on recently, and she was a wow to talk about FMCA and functional health. They're personal, professional and business development seminars, basically. So there's a whole raft of different programs for different purposes, and all of which are open to students. There is a discounted insurance rate, which many students will need when they do their case studies. There is support from a schools network coordinator, discounts on tickets, newsletters. Excitingly, from August this year, we're launching a mentoring service. So we will be able to support coaches and students with mentoring. And if the earlier you join, the better, because sometimes students wait a little while till after they've qualified. Time runs away and they find they've been qualified for 12 months, but they've never joined the association. And then they have to go and find 25 hours of practicum and evidence to actually qualify them to join. So you can avoid all that. It sounds like a sales pitch, doesn't it, really? But you can avoid all that by joining from the get-go and being part of, you know, what is growing to be actually a really supportive global community. You know, we're so excited that we have good friends with yourselves at FMCA and with organisations in Australia and all over the world, really. So it's great. You get that global perspective all the while. Yeah.
Oh,
so that's really all I wanted to say about that. Yeah.
I think this is wonderful news for anybody in the UK who's considering Functional Medicine Coaching Academy, because they can see that not only do they get all this support from FMCA, but they also get that from UK Health Coaches Association. So we really appreciate that, actually. And just before we end, because you were talking about personal professional, I'd love to be able to just get this in. On a personal professional note, I know that you really do have a passion for the modifiable lifestyle principles of functional medicine. And so I wanted to just say congratulations on authoring your new book, The Real Food Solution, which is sort of melding that in.
It is, and it was born really, thank you very much. It was born, I have it here, of course, I have it here. And the profits from the book go to the Real Food campaign, which is part of the British Holistic Medicine Association. And why I wrote it was because I wanted to join the dots between farming, food and health. And I was telling my clients continually that they need to become more conscious consumers. You know, why? Because I want them to understand that it's, you know, their food is real powerful medicine. If it's chosen wisely, if it's consciously sourced, if it's traditionally prepared. I wanted to guide practitioners, health coaches, away from worrying about whether they should be writing diets for people and organising supplements for people, to concentrate on talking to them about real whole foods and keep them within scope of practice. I wanted to dispel the confusion about how much meat or milk or eggs or grain or carbs or fats or whatever it is that we're meant to be eating, we should be eating, and focus on the traditional foods that kept our ancestors and our grandparents healthy for generations. I wanted people to understand why it matters and that you should care about where your food comes from. So it's not only just for the general public, but also for health coaches to help them stay within their scope of practice and to talk to people about real food instead of nutrition. Because, you know, the general public, they know about supplements, but they really don't know very much about real food and what that actually means, you know. So I'm hoping it's that contribution to, you know, not only to supporting, optimizing people's diets, if you will, but also supporting the processes, procedures that the Real Food campaign are fighting for, really. And, you know, in essence, it's around making sure that not only do we understand as individuals and coaches that it matters where food comes from and how it's produced, but it also is important to understand that it's actually, you know, the way that food production has disintegrated over the last 80 years, and it has become a problem for the planet. So it's really, you know, devastating impact to the food production systems on the planet. So that's what the book's about, and it's at 300 and 400 pages of evidence-based science with loads of references. It's not all to be read at once, obviously, but it is. I do encourage you to at least have a look, everybody that might watch this, because you will be helping a charity that is really important and is not supported in any other way.
Well, thank you for sharing that and for your gargantuan effort in getting that all together. And I think this really ties it all beautifully, because when we think about it, everything that you're speaking about in the book and what UKIHCA is trying to put, you know, advocate and put forward out there, this is what functional medicine health coaches are out there actually doing. This is what they're trying to achieve, which is that behavior change in those modifiable lifestyle factors. And we're fortunate to have the IFM, as in the Institute for Functional Medicine, as the science-based research behind doing that. So again, thank you so much, everyone, for being with us, and I'll hand back to Jen.
Thanks, Mahnaz, and thank you, Isabella, and all the graduates for all that you've shared. As I said earlier, the enrollment for our September 2021 class will open very soon. We encourage you to reach out. You can email us at admissions@functionalmedicinecoaching.org or schedule an appointment with one of our admissions team members by visiting our website. Mahnaz has time available that will accommodate your morning, and the rest of our team has time into your evening. And we really would love to meet you and just answer any questions you may have. We look forward to hearing from you. Together, we can make a big difference in the lives of people around the world with the effective combination of health coaching and functional medicine. Thank you so much.